I think we are online now.
Okay.
I'll just take a minute. Okay, so I see Hitesh, Akash, Kanak Kumari, and Manan. Okay, so I think we'll start. I think there are a couple of more people expected. They'll join in the next couple of minutes. Manan, can you just check with them on the WhatsApp group?
Yes, sir.
Thank you. Okay, so I'll start by introducing Professor Srikanth. I'm very thankful that he agreed to, give this talk for us. Professor Srikanth has a BTech from IIT Madras and a PhD from Cornell University. He's currently a professor at IIIT Bangalore, where he's also faculty in charge of computing. His research interests are in the area of computer graphics, geometric modeling, and 3D printing, mobile and internet-based applications, and data privacy. He is co-convener of the eHealth Research Center at IIIT Bangalore, and he is actively involved in multiple collaborative research projects in healthcare. Prior to joining IIIT Bangalore, he had over 28 years of experience in the software industry. In fact, earlier I was just sharing with him that it's a great thing that somebody with your kind of experience is coming back to the academia. I think that adds a lot of value to the student community. So all the more reason I'm grateful to him for agreeing to give this talk. Uh, Professor Srikanth was earlier at Sasken Communication Technologies, where he handled business, technology, and product management roles, and he led various product and R&D initiatives, especially around wireless and multimedia technologies and mobility. He also co-founded and led software development for a startup in the US focusing on geometric modeling with applications in mechanical design and geosciences. Today's talk is about visualization. Visualization of 3D data is an important computational tool in healthcare with applications ranging from medical education, diagnosis, and surgery planning to therapy as well as clinical and drug research. In this talk, Professor Srikanth will look at some of these applications that leverage traditional computer graphic technologies involving surface and volume visualization. Some of the challenges include handling data at vastly different scales, from cell level to macro anatomical features, volume of data, and accuracy of rendering. He will also look at emerging uses of virtual and augmented reality in medical applications. So with this, I now request Professor Srikanth to, uh, to go ahead.
Thank you, Prof. Gagan. It was a pleasure to be here. Thank you for inviting me to be part of this. It's always fun and enjoyable to address a new set of students and get people excited about computer graphics. So I've been working in this area off and on for a while and been very excited about what the field of computer graphics and visualization can be. And more recently, in the last maybe 4 or 5 years, I've been looking at how this plays a role in healthcare, which is probably one of the more basic needs or services that we all have. So while you're all familiar with computer graphics, you've seen movies, you play 3D games, you probably see ads, all kinds of things. I thought it'd be good to look at how the principles you're learning in the course on computer graphics, visualization, translate well into healthcare, medicine, and so on, so that you get a feel for different kinds of the possibilities that are out there. Fundamentally, it's the same techniques, but what we'll see is a different context in which they're being used, and it's a field that's really exploding in terms of how it's being applied and the kinds of technologies that are coming into play. So this will be a quick tour about a lot of them, because actually there's lots of stuff and we can talk for a long time. So I'll do a quick tour and then keep some time at the end to deep dive or answer questions or anything that might be needed. So feel free to ask questions, because it's a small group. I think it's absolutely fine if you would like to ask questions in between, or we can wait till the end and look at all your questions. So I'll start off by controls are always complicated here. So, okay. So we'll focus today on graphics and visualization using standard computer. So I'm basically going to stay within the area of computer graphics as you're studying. We'll go a little beyond into volumetric rendering, but it fundamentally uses the same techniques. And then we're going to focus on certain applications in healthcare. Again, there are lots of applications. I've handpicked a few which I thought would be different and interesting in terms of where it is. So roughly, I'll do the following. I will talk a little bit about the context, what exactly we mean by medical data and what we're visualizing, the techniques that I use to visualize them. A lot of what you do in OpenGL and the basic computer graphics, the surface rendering. Actually, we use graphics to render the surface of solid objects. Here we have an added challenge of the data is in a different form, so we have to look at rendering volumes of data. Then, like we mentioned, we look at virtual reality and augmented reality applications, which are essentially taking the same techniques that you do game development and movies, and now instead trying to do something around healthcare. And if you have time, I'll just spend a few minutes at the end to extend this to 3D printing, because the same technology, once you can visualize something on the computer, now you can actually take it and print it and actually hold the model in your hand. And that opens up a lot of interesting things in healthcare. And I will make these slides available later. So I also put down a list of a couple of books and other things that might be interesting for those who are interested, right? At least as a background reading. Okay, so the basic, so one big part of the focus here is going to be on visualizing data about human, the body, basically, the anatomy and so on, so that doctors can get a better idea of what's going on, can plan interventions, can do diagnosis better, can treat you better, and so on. So a lot of the focus of visualization in medicine is about the human body, the anatomy, and so on. Okay? And this goes back, a long time, going back to the invention of X-rays, discovery of X-rays, whatever you want to call that, where Röntgen, as you would have learned in your physics, actually took a photograph of his wife's hand using an X-ray, and the ring on the finger is visible there, and these kind of things led him to understand how X-rays work. It basically allowed doctors after that to get a good idea of the substructure, the internal structure of the body, and specifically nowadays X-rays have improved to such an extent that you can get fairly detailed idea of the bones in the body. So the things that are opaque to X-rays show up as white, the things that are transparent to X-rays show up light, and from that you get a fairly good peek into the human body, but it's very limited. Right? You can only pick certain structures, tissue don't come out well, bones come out well, you can't make a difference between tissues and so on. So over time, there's been a lot of other what are called modalities, other ways of capturing. So essentially the problem is, how do we get a photograph of the inside of a body and then be able to visualize it so that we can do something? Let's take the simple example of a doctor trying to see where a fracture is on the bone, something like that, right? So X-ray works good for that. The extended or improved versions is CAT scan, computer axial tomography, which is essentially like an X-ray, but you do multiple slices. But like I said, X-rays are still limited in what they can capture, the kind of information they can capture. So that's when things like MRI came up, magnetic resonance imaging, which is able to capture tissue better. And then going further, looking at cellular activity, you have things like PET, and then you have things that capture the activation of, let's say, the blood flow or fluid flow. So you have various kinds of MRI variants that are there. Each of them helps us get some information about the inside of the human body, so that, let's say in this context, doctors can visualize it and then start planning things based on the diagnosis onwards. So you'll be probably familiar, there's these MRI machines. I hope none of you had to get an MRI done. None of us wants to be inside that, because that means there is something that you're trying to diagnose. So essentially, the person lies inside here. It's the whole thing, the whole tray bench moves inside this donut-like machine, and inside these are the things that generate magnetic resonance waves, and then the signals are picked up and computed into something that helps the doctors. And essentially, you get, as I'll show a little later, you get like snapshots. You get slices. Think of it as you're doing multiple X-rays of the head, let's say the head in this case, you're doing multiple parallel slices of the head as X-rays, and then you're able to piece that together. So the MRI produces some complex thing, and then what we are going to look at is how do you take that and say, get a picture of the, how do I do this 1 second? Yeah, how do you get a picture of the spinal cord as an example, or actually be able to look at this, look at the, the heart and the vascular structure around the heart, all using the same data. So the part we are interested in is the data. We don't worry about, I don't understand anything about how MRI is captured. At the end of it, you have a bunch of data, like a bunch of images. Then we want to be able to extract and help the doctors view it. And that is the first problem we look at, is what's called volumetric visualizing. Visualizing is MRI type data. So think of it, like I said, as slices of X-rays. Each X-ray is slice is nothing but an image. It's a 2-dimensional image. So think of it as a 1 megapixel image. As a typical resolutions these days are 1,000 by 1,000 in each slice. So it's roughly 1 megapixel per slice. But you can have large number of them, 100 to 1,000, depending on what you need. So you end up getting a lot of data, 5 megabytes.
Srikanth,
yeah.
These slices are in all 3 dimensions, like XY plane, YZ plane.
The slices are captured in one direction, but then they can be viewed in any direction. That's the whole volumetric visualization part. So you actually think of it as imagine your transparent images, and you have 100 of them stacked one on top of the other, each of which provides one slice. Right? So now when you put it together, it looks like a volume.
Okay.
And that is exactly what the volumetric visualization part is. You have a number of scans. Each scan is one slice. But now, since we have the scan, we should be able to view it any way we want. That's the goal of this thing, right?
And
so exactly. So
time, I mean, like MRI scan typically takes a long time. X-ray is instant, but
no, MRI, the capturing of MRI takes time.
Yeah,
it can be 20, 40 minutes, because you have to do this you're doing at even though the output is so let's take a typical picture. It's 1,000 by 1,000 image for about 10 centimeters. So it's about a 0.1 mm resolution. Right?
Okay.
But the actual capture happens much finer, because they have to do a lot of processing to come up with that image. So it's very fine-grained capture, which is then processed and averaged and all those things to produce the MRIs that we have. Right?
Okay.
So yeah, so each image, each slice is roughly, like I said, think of it as a 1 megapixel image, 1,000 by 1,000 roughly.
Okay.
But then you have a stack of them. So if I can look at the whole stack in different ways, it's like looking at a 3D volume.
Okay.
And that's exactly what the doctors want to do. They want to be interactively in real time manipulate this volume of data, the stack of slides. And so they want to look at it from different angles. They want to cut it. They want to hide certain features. I want to see only bones. I want to see only the heart, those kind of things. So the tools that we have allow them ways to adjust colors, transparencies, hide and hide features, so that they can visualize. They can look at the internals of the body the way they want. That makes sense for that particular case.
Okay.
And needless to say, because we are now the doctors are going to use this to make critical decisions, we need high accuracy in the rendered image. It is not. So the big difference we get now compared to the traditional. So if you think about graphics as it's used for movies and games and so on, the focus is on making it look reasonable. You can have errors, but it should look reasonable. Right? Photorealism or making it look good is a focus. Or the way I tell my students, that you do enough to cheat your eye. The whole thing about computer graphics is how you fool the brain into thinking that you're seeing something real. Right?
Yeah.
Now it's slightly different. The doctor is going to use this to see, is that a spot or is that an artifact of the image? Right? So the accuracy becomes very, very critical. So some of the techniques that we traditionally use, like texture mapping, doesn't at all work in this realm, because the accuracy is important.
Yeah.
So the data has to be rendered with high fidelity, and any algorithms you use for rendering should not distort the data. And that's actually one of the biggest challenges.
Okay.
Because going back, so just keep that in mind. Right? I mean, there's no complete solution for that, but this is where it deviates from traditional computer graphics as we normally understand. So if you broadly think of it as graphics for entertainment, I'll take movies, games, and a lot of other things like that. The purpose is very different. You want real time there also. You deal with large amounts of data there also, but you want to quickly project something and we look at animation, you want to do 30 frames a second and things like that. So
Yeah.
you can get away with a lot of stuff if you can avoid drawing something. Here it's not like the doctor might zoom in and say, I want to get to this particular area because I want to see, is there a growth there? Is there a fracture there? Whatever. So no compromises on quality. Unfortunately, the data is intrinsically noisy and fuzzy because it's captured. I mean, imagine the MRI it goes on for 20 minutes. People will move a little bit. How much are they strapped down? We're talking about, remember, millimeter or sub-millimeter accuracy. I mean, human capillaries and things like that are millimeter scale or even less. Right? While the body is 10 centimeters, I mean, the head is say 10, 20 centimeters range, individual features can be at the millimeter or sub-millimeter range. So we have a scale of about 1,000. Right? So that is one of the challenges, that there will be noise in the data, yet algorithms have to be developed to make it still reasonable and meet medical standards, right? You don't want to have any problems or errors in medical images.
Yeah.
So that's so you have size of data and you have the resolution or the accuracy of data. The two sort of competing things. If you want to draw something very fast, which is large, you have to make approximations. At the same time, you can't compromise on the quality, and that is one part that all these systems have struggled with. They've done reasonably well. So we will look at so just to the way we think about it, therefore, is what are called voxels. Think about a normal photograph in an image, right? You can think of it as every pixel is a rectangle. Every pixel represents a rectangle, and your photo is nothing but a collection of pixels, a rectangular array of pixels, right? When we say 10 megapixel image, the total number of pixels is 10 million, and they're spread by, it's a 3000 by 3000 or something. What we do is we just generalize that to 3 dimensions. So we call it a voxel, a volumetric element, a voxel. And we think of each cube of data as one unit. And there is some value there. Just like you can have an RGB value in a pixel, you can have an RGB value in a voxel. Exactly the same thing. So it's nothing but taking a bunch of pixel images and stacking them together. And now you interpret that as a 3D volume. Obviously, the volume that we are doing, we have an image in images of infinitesimal thickness. So we have to make some assumptions. So we'll say that this entire cell, entire voxel is that color. Just like we say the entire pixel is a color. Right? What you're seeing on your screen now is nothing but a pixels, right? You got a 1700 by 1200 resolution screen, and every pixel has, the only thing that's happening is every pixel has one RGB value. And the whole purpose of graphics is to color all the pixels correctly. You take your region of interest, you color every pixel correctly. So now we have that, but we have 3-dimensional version of that. And what, therefore, the visualization thing is about taking the 3-dimensional pixel and projecting it onto a normal screen, onto a 2D screen. So think of a cube that you have. Depending on how I'm looking at it, I can see different views of the screen. So that's what we're trying to do. Just like if you take a normal graphics, you take a 3-dimensional surface and you project all the triangles onto the screen. Here we have instead a cube of volume, and now we have to figure out what it means to visualize it. Because the outside of the cube is not interesting. The doctor is not interested in your skin, right? They were interested in what's inside. So we need techniques to go into the volume and extract information and visualize it. And that is the game of volumetric visualization. Ultimately, we have to do surface or point visualization. There's nothing else you can do. Because ultimately, you have to draw one pixel on the screen, every pixel on the screen. Okay. So maybe I'll just show this, and then it'll be easier to understand what I'm talking about. Unfortunately, I think I will switch and share. Okay.
Software package for visualization and image analysis. You can download it from the Slicer webpage, and
Yes.
I'll place a link to that in the.
Just 1 second. I think I didn't share the volume. Yeah, okay.
The description box below this video. So during this tutorial, I'm going to highlight just a few features that exist within Slicer, but you can explore other capabilities using the Slicer wiki, and I'll place a link to that in the description box below the video as well. So that being said, let's jump right in. Again, the purpose of this tutorial is to prepare data for 3D. And it's really that simple. So now my data is loaded into Slicer, patient in my browser named Anonymous, and a new study for that patient named None, which might normally be a date or other information. And all the series for that study will be listed below. I only have one, so that's my cone beam CT. And when I click on it, Slicer will first check for the appropriate plugins. And once that's completed, I can click Load Selection to Slicer. And it's really that simple. So now my data is loaded into Slicer. I'm going to just switch my layout to the 4-up view so that I can see all the slices more conveniently. And I can, of course, scroll through the data using my scroll wheel or whatever scrolling option you have on your mouse or trackpad. If you're unhappy with the window leveling of the data, then you can change that simply by clicking and dragging. So if I do a left click and drag up and down, that changes the brightness of my data. And clicking and dragging left and right changes the contrast.
Here, what they're basically doing is what Professor
I'm pretty happy with where it is right now, so I'm going to leave it there. If instead of a left click and drag, I do a right click and drag, that allows me to zoom in and zoom out of the data. If you're using a mouse or trackpad that actually doesn't have a right click, you can hold down the control key on. So you can see that the first option here is which volume. Shift click and drag to pan this rendering in space, just as I would in the slice views.
Here now you're seeing
and I'm actually going to use this icon in the top left, which looks like a coordinate system, and that will center my scene view onto my volume rendering. So that's a convenient way to do that. So I'm going to pick this one called CT Bone. And when I do that, you can see the bones in the cone beam CT volume rendering. And I'm going to just zoom in here so you can see the TMJ. And you can see there's a little bit of an obstruction to my view, so I'm going to just increase this shift value or this threshold value such that only high intensity aspects of the data show through. And you can see now that the TMJ is really clear. So I can see my TMJ in the volume rendering, and this will be extremely valuable to me as I crop. So now I'm going to enable the cropping in the volume rendering module and display the region of interest. So you can see right now that the whole volume is included in the ROI. But as I shrink that ROI, the cropping is visible in the volume rendering in real time. So this really helps me inform which part of the volume that I'm picking during my crop. So I'm going to go ahead and just limit this down to the TMJ. And I'm going to use the shift hover to reveal this slice in the other sagittal and coronal views. And I'll continue shrinking this ROI until it contains only the region that I'm really interested in. So on the superior side, I'll crop out most of the temporal bone so that ultimately my 3D printed model really centers on the TMJ. And you can really see here how my volume rendering is helping guide the region selection. So I'm really able to specifically target the part of the volume that I'm interested in.
So you can see that here we see a normal 3D rendering.
And now I'm fairly happy with the ROI that I've created. So this is the subvolume that I want to crop down my cone beam CT to. But tutorial, you can also select save from the file drop down. So the first thing here, and then I'm going to click change to desktop, and sure enough, there are my temporal and mandible surface models saved as STL files. And this is the information that I'll use with my 3D printer. And this is
so essentially, you're able to extract out any features that you need out of this thing. So that's the basic idea, right? So basically what they've done is they've taken the cube of data, loaded into the software. It allows them to see it as slices in any direction, or see the whole volume from a typical volume render, graphics rendering that we're used to seeing. So what you play around with is the transparency and other things of individual voxels, so you can see the portion that you want. So we'll just discuss that a little more.
So all this processing is done by this is done before it reaches the doctor. So in the lab, the technicians do all this processing.
The technicians only create the 3D volume, right? The visualization is all done real time. The doctors are actually manipulating the thing. That's using this kind of software. The technicians don't do anything on the interpretation of the data. All they do is the MRI software writes out one RGB value for actually one not even RGB value, one either 8-bit or 16-bit value for every voxel. That's all. Rest is all the software, the 3D slicer and other things, helping the doctor manipulate the data and visualize it.
Okay, but I see usually they give us films. Like I got it done long back.
Yeah.
So they gave me these huge films. They did not give a soft copy. They just gave the.
Yeah, it would have looked something like this, right? It would have looked something like this.
Yeah, exactly. Yeah.
You have got a bunch of films, right?
Yes.
Yeah, so essentially each of them is a slice, right? The films you got are successive slices. And traditionally, the doctor would put it up on a wall, on a on the lighted thing, and they will have to mentally match it up in their head.
Right.
They'll say, "Oh, this is slice 2, this is slice 3. If there is a problem here and here, then I can interpolate it in my head." Now they're able to do it with the software in 3D automatically.
Okay.
That's exactly what we are doing here, right? That's the whole point. So it's like earlier, each of these layers was a separate photo that they would put up, X-ray, effectively like an X-ray.
Right.
And then their head, they would have, that was what these radiologists could do, that they could match up in their head. This position on this one must be matching up with that position on the third one. That means there's something going on there. Now they're able to instead take the 3D volume, peel away data that they don't need, either in terms of the volume of interest or the colors or whatever. So as an example, what they did in that is, so bone would have a different intensity of the value compared to skin, as an example, or tissue. So they will say, I want only intensity within a certain threshold range, and that will automatically highlight the bones.
Okay.
So actually, there are actually broadly three different ways in which you visualize it, and we saw two of them there. We saw two of them there. Actually, all three we saw in a way, right? So one is to say that I have this 3D data set. What is the best way to view it? If I give you a cube and say I want to know some internal structure about the cube, mini cube with lots of detail inside, what's the best way to visualize it? So one way is to take slices, planar slices, right? You can just plane and say, what does it look like in that plane? And that's what we saw there. We had three views which had the X, Y, and Z cuts of this, right? So you can look at this. Think of this as one cut, think of this as another cut, and think of this as another. So there are three planes, and you essentially take the data that's on that plane and view it on a viewer. So that's one way, and again needs a lot of expertise to model that in your head. If you have done any kind of engineering drawing or something, you would have learned plan, elevation views, and so on. It's a little bit like that, right? Now we can take that a little further and say it's not just planar cuts. I can have an arbitrary surface that I want to cut it with, and that's what this whole multiplanar reconstruction is. It allows doctors to define a plane that goes, a surface in some sense, that goes through the body, and look at what data that's picking up and flatten it and look at it. And that helps them, for instance, follow a blood vessel and things like that. So these are still 2D techniques. You take 3D data, but you only take 2D slices of it and view it. Relatively easy, can be done very fast with very low accuracy issues, because you only have to work out the interpolation. So this is one technique which is even now used, and you'll always use this along with the other techniques. The second technique is falling to our favorite 3D graphics, interactive computer graphics, where you say that, yes, you have a volume of data, but can you generate a surface for me which shows the boundary of things? So for instance, if I'm trying to show a heart, can I generate a surface, a triangulated surface, a mesh that represents, say, the boundary of the heart? And what it means this is in 3D data, you have data which is tissue data. Remember, I said different tissues will have different intensity values. So essentially, we try to find the places where the intensity has a discontinuity. You're moving it from a certain threshold to another, certain value to another value. And if there's a sudden change, it means you're going from, say, skin to heart, to bone to lungs, lungs to heart. They all will have slightly different intensity in that. So we can use that to identify volumes that represent a particular organ or a feature, and use the boundary of that. And once you have the surface that bounds that, we can now render it using our standard rendering tools, compared through OpenGL, and we're all done. So this is the second approach that's done. So the doctor might have to do some work. Remember, I said the data is a little fuzzy. So an expert thing is needed to figure out that little wisp that you see there is part of the body or part of the, or anomaly in the data. So based on their expertise, they will sketch out, let's say, points of interest and so on. And we have software that can take it and now build a triangulated surface out of it. Once you have a triangulated surface, you can, actually in that example, they were also doing that. Once you have a triangulated surface, you can render it using standard rendering techniques. Give it OpenGL, just set the various parameters you need and you're all done. So this is a second approach. Third and more interesting approach, which is what is used a lot, is what's called direct volume rendering, where you actually render data from the volume projected onto the screen. So think of it like I'm looking at the screen, the volume of data is behind me. What will I see on the screen? I'll see the projection of that. So this follows a standard graphics pipeline where we take the data, we pre-process, we transform it. Here is where some color computations have to get done. You do the shading and lighting, you compose it, and then you render the image. So we use essentially a technique called ray casting, which essentially, if you think about this is the plane, this represents the plane of the screen, and this is my eye. I can think of a ray that's shot out from my eye through each pixel. And whatever that ray hits, that's the data I want back. Right? So that's one way to think about how to do rendering is that, we're reversing optics. Graphics is all about understanding the optics and the theory of optics and then reverse engineering it. So we see because rays of light enter our eyes from an object, which means rays of light from the screen are entering our eyes. We reverse it and say from my eye, if I shoot out a ray, remember, if you remember your physics, optics works perfectly well both ways, right? You can reverse the role of source and image and everything will work the same. So if I take a ray from my eye into the pixel and extrapolate it and have the object behind it, whatever it hits on the object, the color of that is what I will show as the pixel, because that's really what you're doing. So this is ray casting. And so for every pixel now, we have to shoot a ray, which goes into our cube of voxels. And you have to now decide what is that combination of colors that are going to come back to you. And that color is what you'll show on this pixel here. So, we can do lots of things. The challenge here is how do you now decide what color to give when it's touching many things? And this is where the accuracy and quality of rendering come in. There are various interpolation schemes that are done, bilinear, trilinear, and so on, which will help you compute. Given values for different voxels, how do I find the value in between? And so ray casting is one of the common techniques. And the good news is every pixel can be computed independently because the color of one pixel doesn't depend on the color of another pixel. So we can actually parallelize the whole thing, use the GPU, and just shoot out a million rays if your GPU will allow you to do that. And that's why you're able to do it in real time. And that's what you're able to see them moving that and all that in real time. Even on a normal laptop, you can do those things. So ray casting is the technique that's used. And like I said, it has many of the same principles that we have in the normal surface rendering of graphics, because you have to still simulate how light is passing through something. You have to now decide what color to give. And so there is various kinds of computations. So the image has a color. It has not a color, a value, which depends on what the MRI picked up. Now you have to say, okay, if it is that value, I'm going to map it to a bone, and a bone I want to see in a cream color. Or I want to map it to the heart, I want to see that in a red color, and so on. So that's what what's called the transfer function, the classification is done. Then you have to decide how to combine these, because it's not really a solid, right? It's representing colors from everything behind it also. So we have to come up with some techniques, and there are various techniques. I can come back to these if there is specific questions. I'd rather show some interesting images and videos. If you are able to do that, we are able to get fairly detailed pictures of the interior of the human. And if you are like me and you try to avoid biology when you're school, this is difficult. If you like biology, this will be great, right? So I've forgotten what all these parts are and so on because I ignored biology, but I think this is the pelvic bone and this is the ribs and various other organs are being shown here, right? Now, because now we can color them differently, and so it helps the doctors and the students. It's of great value for medical students because now they can visualize what it will look rather than just seeing a printout on a textbook or something. And then you can, start modeling very complex things and allow doctors to look at it. they can say, okay, I don't want to see this yellow colored thing. You can essentially peel it away and they're able to see details. And it's been used to create very complicated models of the brain based on data coming from different sources. So these are like the MRI images we saw at the bottom. And this is the 3D view of it. Color added at a graphics level, a pure visualization level. So we know how to play around with colors, textures, those kind of things. So we can apply those techniques to visualize the brain the way we want, so that the different parts of the brain show up in different colors. The brain is uniformly grayish color, nothing this exciting. But we can make it look the way you want from an educational. There's also great value for doctors to plan surgery. That's the other second big use of it. Now they're able to see the parts better. They're able to say hide the red part and show me what's inside, so they can plan how they will do the surgery and so on. It's very difficult to do it just off MRIs because you have just a slice, while all your surgical operations are three-dimensional things. So, so being able to visualize and then peel out layers and look at it allows them to do planning, so that when they go to the surgery theater, there's less exploring. We don't want doctors to be exploring on us once we are on the surgery bed, right? So it allows that kind of exploratory work to be done, so that they can plan a more efficient surgery. And yeah.
So about coloring, like you showed one slide where they had different colors for different organs, and this slide where they have different colors for different parts of the brain. So is the color dependent on, like you said, you can distinguish between bone and tissue based on the thickness and how much rays pass through it? So is it like that for different organs like liver and kidney and heart?
So most of the organs can be distinguished that way, pretty much based on the intensity, maybe with some fuzziness at the boundaries. What is challenging in the brain is all the parts of the brain look the same. There is no divisions in our brain on left temporal, this and so on. They're all uniform. So there's additional software. Companies have, researchers have developed software that based on other information that they know which part of the brain is your left temporal lobe and so on, right? So that is one level on top that's done on this. So once you have the basic cube of data, there's all kinds of algorithms you can run on it. They find discontinuities in the surface, they find where the thickness is narrow, and they say, okay, see, in the brain, there is no separation. It's all one. It's actually two hemispheres which are within a hemisphere, it's fully connected. There is no separation. It's all what medical guys in terms of anatomy have decided what is. Just like the heart, right? The parts are all connected. It's all one thing.
Yeah.
We are able to talk about it as 4 parts. So all that is software work that happens on top of the core data. The software helps you color the individual voxels so that you can visualize it well. We are only looking at the visualization part.
Yeah.
So if we if you look at this.
Is the final product. So we started with a cone beam CT and we've ended with.
So what now doctor says, okay, that's all very nice. The pictures I showed are nice, but I want it to look real, right? So there are some interesting techniques that are done, which now again come back purely in the visual, in the graphics area, right? Can I take that same data, which looked kind of plasticky there, and make it look like what the surgeon actually sees? So it's exactly the same thing, except now you can see that it's more interesting looking, right? Colors and shininess and things that you're used to seeing in graphics, in photographs. You want to make things photorealistic. So you can see now the bone actually is shiny here, which wasn't there in the earlier things. So these are now, again, what you do is you take the same images and apply light scattering, reflection, those kind of techniques that are the core of graphics, and apply it in this context, and are able to create much more interesting visualizations. The whole point is not for fun, right? This is hopefully the doctor through this is able to get a better view of it. I'm saying fun because I want to distinguish from entertainment type thing where you're doing it to create an interesting response in the human. Here you want to make it look as real as possible so that what the doctor sees on the screen is closer to what they see when they actually cut open the body. Right? I mean, that's a big gap otherwise. A textbook can never quite explain what the insights look like. And here you can see just by playing around with some parameters, they can look at the tissue, they can look at the veins, they can look at the bones, and all in sort of high quality rendering. Okay. Now, I have no idea if this is accurate. Okay, that's the problem, right? I mean, they've done a good job, but in fact, that is where this thing is held up, is because it may not meet FDA guidelines on what is an accurate thing. But it's good for anatomy, good for teaching, good for learning, good for those kind of things, and definitely more interesting than the plasticky pictures we had earlier. So this is how graphics gets layered on top of this basic data extraction to make it look more and more real, interesting, whatever the right term you want. You can see those bones do look like shiny bones, right? Which was not there earlier, which is very hard to do by the way. You have to think about lighting. Imagine an operating theater where you have multiple light sources, right? And then, so what you see has to reflect what a surgeon will see in the operating theater. Otherwise, it's very dangerous. What they see there is not what they saw in the images. So, while this particular technique was pioneered by Siemens, it hasn't quite become mainstream because of legal and other reasons. So, I'll just jump a little bit and.
Patient-specific anatomy is viewed in stunning, lifelike 3D, while direct, tactile feedback and responsiveness is placed right in the user's hand, creating a comprehensive surgical environment where surgeons interact with instruments and tissue in a way similar to real surgery. Through our proprietary patient rehearsal capability, patient-specific images are utilized to plan the optimal minimally invasive surgical pathway and provide patient consultation. This pre-surgical rehearsal offers the critical ability to reduce risk, surgical error, and procedure time, while improving patient outcomes, safety, and satisfaction.
Actual surgery.
Immersive touch is virtual reality for surgeons.
So this is the
sense of feedback is very real. We have a very good sense of tissue and responsiveness to our instruments, similar to that which we find on patients.
Helping doctors
with the immersive touch, we can have preoperative planning, preoperative experience.
And like I said, you can spend lots of time on these things. I already running tight on time. So
the motivation. Earlier days they used to actually practice on, dead bodies, right?
Cadavers, yeah.
So now what is the motivation? That there are a lot of medical schools and they all need to be trained, and that is why they need to do this? Or
yeah, that's one part, right? That's one part of it. You can't have a large supply of. It is becoming harder and harder to get cadavers that they can practice on.
Okay.
And of course, at some point in their training, they'll do that. You don't want them to go into an operating theater without having ever touched a human body. But think about now, there's one big usage that's come up right now is the pandemic when students are all at home. How do they, how do they practice dissection or even look at the anatomy, right? So suddenly in this pandemic, this has become very important. VR for medical education has become a huge thing.
Okay.
At least they can get 70-80% of their learning done remotely.
But the video also showed some specific tools, like those people had some pens and all, which those will not be available at home. At home, you will only have.
Yeah, those won't. No. Yeah. So that's what I said, 70-80%, right? You can still do a lot of stuff. At least understanding what the details are and being able to do. So there are simulation tools that will let them do it without the haptic feedback. See, what they were doing is when they're moving, they would actually get back the force response.
Okay.
So that we don't have, but short of that, you can do everything.
Okay. And for the graphics part, you said that a lot of them use raycasting.
Raycasting, ray tracing, yeah.
Ray tracing or raycasting. So I was under the impression that ray tracing is very expensive and it's difficult to do it in real time.
Correct. That's now changing with GPUs, right? So the latest NVIDIA GPUs can do ray tracing in real time. So you have nowadays, you have what's called hybrid rendering, where you have traditional or OpenGL based rendering intermixed with raycasting. You can mix them both.
Okay.
Yeah, and get near real time. Get real time actually. The latest NVIDIA things you can get real time ray tracing done.
And how expensive are these GPUs? The ones which can do real time ray tracing?
I don't know.
Okay. This will not be
for a surgery equipment, it's not a big deal, right?
I see. Right.
I don't think it's tens of. It's probably tens of $10,000 type of thing, not $100,000 type of thing.
Okay. Right. So it's still not feasible for common people to have it in their laptops, but for specific applications, it makes sense to to get that?
See, it is coming into laptops because it's being used in gaming quite a bit to get more realistic effects. So it's just a matter of time. Okay. So the ones that you get on gaming laptops right now can also already do some amount of ray tracing. So it is just a performance multiplication. NVIDIA has built it into their core, whatever the latest chip style is. I forget the name now.
Okay. Wow. Yeah, maybe do any of your students have this gaming laptop with a high-end?
No idea. I'm sure they do, but I won't know.
Yeah.
Okay, let me just talk about a few more things just so that I can wrap up nicely. And, okay, so I'll jump over this, but the basic thing is you can have multiple modes of data coming in, right? It's not just CT because each of these modalities picks a different feature of the thing. One might pick tissue well, one picks bone well, one picks flow of blood well, and so on. And we have to fuse all this, which becomes a huge challenge to do because they're all done from different sources, they're different resolution, they're different techniques, a lot of things. So the fusing of data and thinking of it as one source of data is one big part of visualization that's happening now. And so what I want to instead talk about is a couple of other, there's one whole thing about anatomy, surgery, all these kind of things, right? So I'll spend another 5 minutes talking about a couple of other areas and mostly do it through the videos because this sharing back and forth is also a pain. So let me, so I'll just manipulate these and
fresh.
Okay. So let's take a different problem, completely different problem. Psychotherapy, okay, psychiatric therapy. So here's a typical problem is that people who have phobias. There's some people who don't want to get into a train because they're claustrophobic. They don't want to get into a plane. They don't want to, they're scared, right? And so there are a lot of these things. And this becomes a huge issue because, as an example, they can't travel, right? So what do psychiatrists do? Psychologists, what they do is they do what's called exposure therapy. They give a controlled environment where they make them get into a closed space and help them get over their anxieties. And the idea is if they do this again and again and again, they get used to it. It could be other things. You could be scared of a cockroach. Okay. So how do you get treatment? Right? So the actual treatment is they put one cockroach on the floor. Once you get used to it, they put 2 cockroaches on the floor and so on. So the whole idea of phobia and other psychological anxiety and other things, there's something called exposure therapy. And VR has become a huge tool for that, using exactly the game development engine. In fact, we are doing some projects where we are using Unity and Unreal Engine to build exactly these kind of things. Right? So imagine there's a person who's scared of getting into a train. So what they do instead is create a VR situation where the person will wear a headset and they will essentially walk into a train and experience what it feels like. You can make it as real as you want.
How are you feeling, Laura? Try to control and calm your breathing. There is a lot of people.
So this person is wearing a head-mounted display, Oculus, or in this case, some VR one or something, and they're able to.
SciAS is the first online platform designed for mental health care.
And this is just standard.
With almost 20 years of clinical studies that demonstrate its effectiveness above established.
So there's actually a lot of research that shows that this is very effective.
The world.
And we are actually
thanks to the revolution in mobile computing, SciAS is accessible to any clinician.
So if any of you have played with these
SciAS
kind
is
of
designed
things,
by psychologists for psychologists.
Right?
The web platform gives the clinician intuitive control over the
set it up so that
patient's
therapists can control
experience,
things,
allowing them to monitor every stimuli and its effect.
What's the anxiety?
The mental health professional can easily adapt the experience to each patient's needs and visualize their psychological response through integrated biofeedback. All of the events, the therapist's subjective input, and the anxiety response are integrated into a report of the session.
Traditional way, you would actually have the
patient
therapist would have to go
feedback
with you
on
and
their
get onto a
progress
train to
across
make you
sessions.
comfortable. And it gets more complicated. Train, at least you can imagine, but what about people who are scared of flying?
For 10 specific
I've been using virtual reality.
Anyway, let's skip this. I'll just show the next one. So these are all commercial products.
Mental health providers go to great lengths to replicate their patients' unique fears. Virtual reality now offers the possibility of providing realistic exposures affordably and efficiently. With virtual reality, mental health providers can reliably control their patients' sensory experience. This allows for more precision and can potentially reduce the duration of treatment. VBI's suite of virtual reality products offer a wide variety of treatment options, including virtual reality exposure therapy to help overcome PTSD, addictions, and phobias. Some of our most successful products over the years include fear of flying, fear of heights, and fear of storms. With over 20 years of research experience, our development team at VBI has created over 60.
Okay. So now you see it's a slightly different thing, right? You're taking a standard VR setup, but using it for something very different. Essentially, one form of therapy, one form of healthcare, mental health, right? Where you have to create realistic scenes that people can interact with. So that is the, and then I should have closed this, sorry. I told you I'll do a quick tour, so this is a quick tour.
Research projects with clinical psychologists.
See this, I'll skip this. Yeah, so the other thing is about modeling molecules, so drug research. And so coronavirus, right? You see all these photos of the coronavirus. Right? Did someone actually take a photo of a virus? Right? So it's data that they've taken and they've created a 3D model so that you can visualize it, right? You can see. And the purpose of visualization is mainly to help the doctors understand how it works, which is all structural in nature, right? Proteins, viruses, all these things have a structure. And what happens is, let's say there's a protein in the body, a drug or a virus, something goes, attaches itself to some place based on the geometry. So here, this is a case where there's some complex protein and they're designing a drug which is supposed, they want to see if it can go through that hole and actually attach to the protein. So this is all done through simulations. And this is nothing but a typical 3D model that we deal with. Right? So you make molecular modeling is used for biological sciences is a huge, so it's brought down the drug research, which used to be a hit and miss type of thing, to something where they can actually visualize and try to come up with a good thing. And you can imagine you can zoom into this and see features at a much more detailed level. And so this is another area where graphics is being used. And one last one is, so remember I'm trying to talk about scalars. We want to see humans, we want to see trains with humans in it. You want realistic looking humans sitting in a train. You want to see the anatomy, which is still in the order of centimeters. Within the anatomy, you want to see capillaries, which are the order of millimeters or less. And then you want to see molecules, large protein molecules, which are fairly large. And then all the way down to cell level. So when you do a biopsy, as an instance, the pathologists take a slice of an actual tissue and look at it under a microscope. And so when you look at it in a microscope,
digital pathology is concerned with exploring and analyzing huge images for clinical diagnosis. However, a single image does not reveal the spatial structures of the underlying tissue. For this purpose, we have developed a tool to interactively visualize stacks of such images at native resolution. The design process involved a close collaboration with domain experts to meet their needs and requirements. A qualitative evaluation with 14 practicing pathologists revealed a large potential for 3D histology.
So it's basically now you take, just like we did for MRI, we take slices of tissue at a cell level, and you want to be able to see, zoom into a cell level and all the way out to a tissue level. The cell level, we are talking about 1 micron, 1 micrometer type of resolution, okay, down to up to a few millimeters, a centimeter or so, right? So that's the scale we want within a graphic system. And in these examples, each slice is about 1 gigapixel, 40,000 by 30,000 pixels. So that's 1.2 gigapixels. So suddenly we're talking about images. Each image is 1 gigapixel. You may have 10 to 100 of them, and you have to manipulate it in real time.
That's terabytes of data.
Terabytes of data. You're getting into many gigabytes, and the doctor still wants to see it, and they want to do real-time manipulations. So this is another kind of challenge that's there from a visualization, but with very, very, very. So I work with some pathologists, and and they really want to see this. They say it will change the way we do pathology if you can really visualize in 3D. Just like MRI has changed the way doctors looked at the anatomy, 3D histopathology, 3D pathology will change the way pathologists look at biopsies. Okay. So I will stop with that and give you guys some time for questions. So otherwise I can keep, there's so many examples, you can keep talking. So please, I really would appreciate some questions, some comments, anything. It's a small group, so feel free to talk. Nothing is out of bounds, or nothing is too simple a question.
So
in class, what I do, otherwise I start calling out names. So
I'll start. I have this. So I like this example of psychotherapy wherein you showed that a person is being taken into a train and wearing a VR headset. So in terms of hardware, how expensive is it to set up something like this?
That one is actually quite simple. It's a gaming. It's basically you need a gaming setup. Okay.
Okay.
So you get a good laptop. And it also depends on what kind of head-mounted display you use. You would tune the quality depending on the hardware you have.
Right.
So nowadays, many things can be done on good quality. So let's say a mobile, which is in the 30,000-40,000 range, with a normal PC is plenty. Or you go for an Oculus Rift-like thing, which is Oculus Q or something, which is the 10,000-20,000 range. But then you need a laptop, a computer, which is roughly 1 lakh.
Okay.
Sub 1 lakh, roughly, that you can do a great job. That's something clinics believe they can do.
Okay, but you're saying these are already commercial solutions. So the rest of it is software development cost.
Well, see, it's commercial in the sense that they're building using a game engine to build it, right?
Okay.
So when we are talking to the doctors in India, they're saying these settings don't work in India. We have to make it more culturally specific. You have to make the people look more like it. The actions have to be, a lot of things have to change, right? So you end up recreating that, and they have their own theories on what works, right? See, somebody has taken some psychologist has given a script saying this is what it should be done.
Yeah.
Doctor at Nimmans may or may not agree with that. So that's not the way to do it. This is the way we want to do it. So the game sometimes has to be redesigned. I'm using the game terminology because in some sense we're using it from a graphics or a game development standpoint. That's what we're trying to do.
Yeah, even for example, if you take Bombay local, I mean, or a metro in Delhi or a metro in US, the number of people and the structure, it will be completely different.
And if you want to do exposure therapy, which is actually expose them to the real situation, you ought to make it look as close to the real thing as possible.
Yeah. Got it. Okay, so Akash has a question.
Go ahead, please. Yeah.
Hello, sir. So, sir,
go ahead, please. Yeah.
Okay. My question is not related to the health. My question is related to computer visualization and graphics. So, as you mentioned that the computer graphics is the base for visualizing computer visualization. So, sir, in a recent year, there is a technology called 3D printer. So, what is in the base of that technology? Is this a computer visualization or computer graphics or both?
In fact, I have just, if you want, I can just show a couple of slides on that. I had that in my list because 3D printing is one of my fascinations, and I came ready for your question. Okay. So basically the idea is, so if you look at the visualization pipeline that we saw, right, there's data coming from different modalities. You build one of the key things is you build a 3D model. Graphics really only looks at the visualization of it. Model building is still a different technology, different set of techniques that have to be there, right? Once you have a model, like we saw in that first slicer thing, there is software that can take it and create a printable model. So you can now create a plastic model that exactly reflects what you are visualizing. So there is a lot of commonality in this part of the pipeline. So in fact, that is the great part about it. So it's actually being used by surgeons to analyze. So especially this is very important for abnormal surgeries where, let's say typically children were born with some conditions, which everyone will be unique. So they don't have a textbook to say what it is, right? An MRI or CT doesn't. So if they're able to print it, they're able to actually take it out and say, oh, this is what it really is. Now I can plan my surgery better. So there's a commonality from so actually at our place, we work on this. So we took MRI images, extracted it, and actually printed the brain and the part of the spine and stuff like that, just to try out the algorithms that are there. All these algorithms are available, not a problem. So open source software is available. So 3D printing is the one, I call it physical visualization, right? You visualize it, but physically, but it's exactly the same thing in terms of, so graphics, we focus more on the quality of the image, how it looks. Here we focus more on the accuracy. Are you able to actually get the part the way you want? That part is common to both, right? So the 3D model has to be correct. Okay, does that answer the question?
Yes, sir.
Okay. Thanks.
So I remember 3D printing from these, Mission Impossible movies where, Tom Cruise always prints somebody else's face. I mean, is that level of 3D printing possible? That realistic?
It's getting, so it's a budget issue. How much money do you have? You tell me what your budget is and I'll tell you what you can. So the 3D printers range in cost from $1,000 or less than $1,000 to $500,000.
Okay.
So it depends on what you're willing to pay. It's purely that, nothing else. The technologies, the pre-processing techniques are identical. The printing technology depends on what you can afford.
Okay.
So here are some examples. They're being used to build implants, right? Like of the hip joint or bone joint, jaw bone, and so on, where you can afford to have spend money.
Yeah.
Here you have to have a high-end printer that's doing it. This is a cool application, right? Anybody who's broken their hand will appreciate that this is a nicer cast than what you normally do. So you can get a cast that's customized. So you take a scan of the hand, create a 3D model, and then print it. Or, now more important things like, robotic exoskeletons and artificial limbs and all these kind of things. So the technology is similar. The exact machine you do depends on who's going to drive it. But there's absolutely no problem printing if we don't have tissue printing in good quality yet. We have metal and plastic and ceramic and so on. So human face as a soft, by the way, you can print in soft materials also. That's not a problem.
Okay.
Just that you don't have cells yet. 10 years away, 5 years away.
Okay.
So this is actually they take, from a CT scan, you can actually take out a print. So the idea, doctors are very excited about this because now they can physically feel the thing before they ever get into the, or some of these parts they never seen, only seen on textbooks. Whenever I show any of these pictures to doctors, they get totally excited. They say, can we do it? I said, yeah, give me the money. If we can buy a machine, we can build it. And a lot of startups and others in India are doing this work now. So.
Okay.
Anyone else? Hitesh, you've been watching things interestedly, but I'm able to see your video. I can see only a few videos here, so I just called out your name randomly. So.
Sir, actually, I wanted to ask that what is the scope of in VR and all this in the this field? Is it big or? I mean, I don't know
how to size it, right? There is a lot of work going on in this area, right? So I don't have a good feel for the size of it. I know a lot of startups in Bangalore who are doing VR for medical applications. Okay. That much is there. It is an area that's getting a lot of focus because remember, VR is becoming cheaper and more common, right? So on the one side, Facebook and Google and others are creating devices. So it is a matter of time when this will converge, right? Right now, it's limited by the quality, which means the quality of rendering is going to depend on the quality of the device that you have. So I would assume in like year, it gets better and better, right? Microsoft is pushing this like crazy with their HoloLens. So they have huge divisions that are working on this. Philips, Siemens, all of them are working on this, either for therapy or for other things. And like I said, startups are doing surgical simulations, therapy. All of them is having. So I don't have numbers, but it's there. And I think what will happen, just like it's being used for real estate. And so I'm working with a company who does actually VR for real estate. And now they instead doing it also for healthcare. It's the same skills, same technologies.
All right. Thank you, sir.
So by real estate, you mean that it's like a virtual walkthrough of the apartment building or a commercial complex?
Exactly. Now there are companies that do, when you want to rent a site, you can look at it virtually and do 3D walkthroughs and things like that. Or architects, right? So they do a 3D model and you visualize it before you actually spend money on doing it. So that is the architecture. I mean, building architecture has changed completely. Nobody builds physical models anymore. They build virtual models, give you a full walkthrough, you change all these things. Or shopping for furniture. IKEA and others have these great demos where you picture what a sofa look like in your room using augmented reality.
Okay. Yeah, I think
all these techniques are very common now.
Right. Even I think this Urban Ladder has that in India. You can take a photo of your wall and then they'll put a sofa there so that you get a feel for it.
So now you have these AR, either mobile-based or headset-based, where you can look in the direction and suddenly a sofa will pop up in your room, in the real room, right? So you can see, do I like the color, do I like the shape, and so on. So now we just have to use our heads to say, what does this mean in medicine, right? How can a doctor use the same technology? And that's the focus we have in our lab here.
Great.
It's also used to treat the post trauma of a fight or a
PTSD.
War. Yeah, PTSD.
I had one of the examples, they just flashed that they showed a war scene. It's exactly that, right? So once
they showed the bombs and all that, the sound and all that.
So once a soldier comes back injured or traumatized by the war, they have to get over it. So exposure therapy, unfortunately, is the only solution. They expose them to that again and again and say, reduce their anxiety levels by changing that, by saying it's manageable. So they get over it over time. So I've seen a little simple experiment. I don't know if any of you people are scared of cockroaches, right? Many people are. They can't stand, they'll scream, they'll run out of the room and so on. So there's this little app you have on a mobile phone. You look at it down, it's an augmented reality app. So you just look at the floor and suddenly one cockroach will appear to be running there. Okay. And if you get over it, then 2 cockroaches will run and they'll run faster. And in fact, the therapy things, they give you a stick and ask you to go hit that, the virtual thing. So you actually, experience that whole thing without ever a cockroach actually being there. It's used a lot for stroke victims, right? Stroke victims who lose memory. AR applications are very good. They'll be looking at something, suddenly you can make a familiar object pop up there and they practice what it is. So all this used to be done by therapists coming to the house or the patient going to the doctor and doing it real time, doing it face to face. Now we can make it all virtual. Right? Just imagine how much simpler it becomes. The cost goes down. So many things can change, right? Because we can bring in these virtual technologies to bear on those things. I mean, to make it, I think that in a few years to make it really nice, but the ideas are there and people are starting to come up with these applications. It's not that difficult technically. The quality, maybe making it look real is the only challenge. Right? Otherwise, it's not. The AR, VR is all standard technology now.
Yeah, I think when you see some of these futuristic movies, then you also see the other side of that. These technologies are highly developed, and then there is some AI which has evolved its own consciousness and it's trying to take over the world or things like that. That is the
So I prefer to stay out of the movie examples. That's exactly why I try not to, because that takes, movies are great for improving the technology, right? A lot of the computer graphics technology has progressed because of movie and games. If those were not there, the hardware and other improvements would not have happened. But having got that, let's see if we can find some other uses. I don't want to make judgments here, but I'm saying there's a great area in healthcare that needs help.
Yeah.
So anyway, the idea was just to expose you to this whole other side that's there, where what you're studying actually fits perfectly into any of these streams. They're exactly the same technology. Of course, there will be extra stuff that you have to do depending on the domain, but The core graphics is the same. It's just only you have volume visualization in addition to surface visualization.
Yeah. Great. Any other questions, guys?
One question per person. A couple of more minutes, so you can at least do one more question. Okay, was this useful? Was this interesting, useful? You can use that to start give some. What did you pick up out of this? Any one of you? What was new or different that you picked up?
Actually, it opened the new era of thinking that what we are learning is the base of this new technology. So it gives a exposure to maybe explore in this era in the future. So
that's good.
Yeah, it's very good.
Happy to hear that. Yeah. For me, it was an eye-opener, by the way. Okay, so I worked in geometry and graphics for a long time, so I was aware of medical applications way back, right? And also saw its application in other engineering. But recently, because of the improvement in technology and the data, right, the kind of data that's available right now is much more precise because of the MRIs and stuff. So suddenly, we are able to get very precise data, and we are able to very good digital data. And then we are able to now have graphics techniques that can visualize it. So I think there's going to be a huge growth in this area.
So are there resources? I mean, are there online resources from where you can download volumetric data and then play around with it?
Plenty. So I'll have this 3D slicer that I've shown here is open source. There's another one called FreeSurfer, and they all have tons of data that you can play around with. It is not difficult at all to get sample MRI data of the head, the neck, all these kind of, and all those things are easily available. So you can just install them and try them. There are lots of packages. Okay. So one good thing in the medical domain is software is given free. Okay, I mean, there's tons of open source software that's available for these things of reasonable quality. Enough for our learning. It may not be good enough for a doctor to use clinically, but for learning and understanding, they're good.
Okay. I'm just thinking if this could be covered in the introductory course on graphics. I had not planned for it. I'm just thinking now.
We do it in our advanced graphics course. We do it in the second one.
So you do it in the second course. Okay. Okay.
Because the first course, you're still doing basic principles in surface rendering and textures and all those things, right? That takes up.
Yeah, that takes up a lot of time. We are still there. Got that. Okay, so any more? We have a couple of minutes more. One more question. Yatharth, you've been very quiet.
Somebody has to ask a concluding question so that we can wrap this up. We can't leave it hanging like this.
Sir, I have one question. Does this technology used in plastic surgery?
Oh, yeah. So, actually, it's used in 2 or 3 ways. One is to do plastic surgery, right? They have to get an accurate model of the current thing, right? So, they can use, so it's more of the modeling side, right? How do you create a model more than the visualization? See, graphics, we actually those two become fuzzy. There's a model generation and there's a visualization. We mix, they both are 2 distinct parts. I mean, this is what I was trying to show in this thing, right? So if they do like plastics, let's take reconstruction after accidents and things like that, right? Or after cancer surgery. So they actually take the MRI of one, let's say a person has one part of their face damaged. They have to redo the bones or something. So they take the MRI of the other half, mirror it, and adjust it and see if it looks right. And then they use that to measure it, visualize it, 3D print it, whatever is needed. So it is used a lot in looking at what it might look. If you take plastic surgery specifically, it helps model and visualize what it is now and what it can look like. right? And that is exactly what the surgeon does mentally when they do it otherwise, right? So imagine doing this without a software like this. Right? They have to do it all in their head. So slowly we are making it more and more accessible to doctors of different skills also.
Got it. Great. So I think, should we stop here? I think they need to go for lunch. It's their lunch time. And we have 75-minute lecture slots in the online model. Otherwise, we would have 50-minute slots. So instead of 15 to 3, we now have 75 into 2. So at the end, I would like to thank Srikanth. Thank you, Srikanth, so much for this. This was completely new for me. I have never really, my research was not in graphics. So I am also picking it up as I'm teaching. And visualization was something that I had never really experienced. So this was completely new for me. And the examples that you shared were very amazing. The kind of applications it has in healthcare, it's very inspiring to work in a domain like this. So thank you so much for sharing this.
Welcome, and thank you for setting this up, and thanks to all the students for sitting through this and understanding, following what's going on. So hope some of you will find some, and so again, as my contact, so feel free to reach out if you want more information or anything like that. I'll be happy to correspond on that.
Okay.
So thank you all, and spread the word to your friends, your juniors, and things like that. There is more to graphics than just game development or movies or things like that. I think that is how that's what we all have to understand, that technology has many uses, right? And you find what works for you, and maybe hoping one of you will become a big developer in healthcare visualization.